Namaste. I am Dr. Somnath Vasudev. I am the head of the Department of Neurology at Apollo BGS Hospitals, Mysuru. Today, in this COVID times when all of us are in distress, I have come to you to talk about stroke and with particular reference to this period of COVID where a lot of problems are happening to patients who develop stroke. Stroke, as you know, is a medical emergency and it is something which can be treated if you do not delay treatment. At Apollo BGS hospitals, we have been pioneers in treatment for acute intervention in stroke, be it IV thrombolysis, whereby we use a drug to given as injections, intravenous injection to dissolve the clot, and even mechanical thrombectomy, where we do a procedure in which a wire is inserted into the body through the blood vessel, goes up to the area of block and removes the blood clot directly. We have been doing this on a regular basis since last many years, and we have been the leaders in this in the city of Mysuru. But of late, this COVID-19 has created a lot of problems. People fear coming to the hospitals because of this COVID-19, and that is a mistake because stroke is much more deadlier than COVID-19. COVID-19, if you see the number of patients who are dying, it's hardly 1.5% of patients who have been affected or infected by COVID-19. But the mortality rate in stroke is much, much higher than that. And more importantly, it is not the deaths alone in stroke that is important. It is the permanent deficit that is left behind for the patient to live for the rest of his life. So do not delay treatment in stroke thinking that you will get COVID if you come to the hospital. It is much more important now to come to the hospital as early as possible, because in this COVID times, there are some additional tests that we may need to do, like COVID testing, before you take up for the treatment for stroke. There should not be any delay in you coming to the hospital. There is absolutely no connection between patients having COVID here in the hospital and for those patients who are coming, or non-COVID patients for other treatments. There is a clear distinction and there is no connection between the two patients in our hospitals. So do not fear COVID and delay the treatment for stroke, which can result in serious permanent disability with which you will have to live for the rest of your lives.